Welcome to the Practical Behavioral Care Podcast, where real conversations meet real solutions. I'm your host, and each week we break down mental health and behavioral science into simple, practical steps you can use in everyday life. Whether you're supporting someone you love, navigating your own mental health journey, or working in the field, this podcast brings you evidence-based strategies, meaningful insights, and compassionate guidance. Before we begin, please remember that this podcast is for educational purposes only and should not be considered medical advice. Always seek help, diagnosis, or treatment from your own licensed healthcare provider. Thanks for joining us. Let's get into today's episode. Today, we're diving into a topic that's often misunderstood: schizophrenia. It's a complex brain disorder that affects the way a person thinks, feels, and interprets reality. And while it is a lifelong condition, modern treatment and support mean that many people can and do live meaningful, stable, and successful lives. Early recognition and care truly make a difference. So, what does schizophrenia actually look like? Symptoms tend to fall into three broad categories. First, we have positive symptoms, things added to someone's experience that others don't perceive. These can include hallucinations, delusions, disorganized speech, or confused thinking. Then there are negative symptoms, the things that reduce a person's ability or motivation. You might notice decreased drive, limited emotional expression, social withdrawal, or trouble starting and completing tasks. And finally, cognitive symptoms. These affect memory and thinking, difficulty concentrating, challenges with planning or organizing, or problems with memory. Not everyone experiences all of these, and symptoms can vary widely from person to person. So, what causes schizophrenia? There isn't one single answer. Research shows it's usually a combination of factors: genetics, brain chemistry, early development, environmental stress, and even substance use, especially high-potency cannabis. These influences don't cause schizophrenia on their own, but they can increase risk when they interact in complex ways. Treatment, though, is where hope really comes in. Care is personalized and often includes antipsychotic medications to help with hallucinations, delusions, and disorganized thinking. Therapy also plays a major role. Things like cognitive behavioral therapy, social skills training, and family therapy, and supportive services such as vocational programs, case management, and peer support help people maintain stability and pursue their goals. Lifestyle habits, good sleep, stress management, healthy nutrition, avoiding substances can make a real difference, too. The bottom line? Schizophrenia is a medical condition, not a personal failing. Understanding it, seeking help early, and offering support without judgment are powerful ways to reduce stigma and help people live well. If you or someone you care about is struggling, reaching out to a healthcare professional or support service is an important first step. Thanks for joining me on today's episode of the Practical Behavioral Care Podcast. Schizophrenia can be complex, but understanding it is the first step toward reducing stigma and supporting those who live with it. If you found today's conversation helpful, be sure to follow the show and share it with someone who might benefit. For more resources and practical guidance, visit Practical Behavioral Care. Calm. And remember, compassion, curiosity, and early support can make all the difference. Until next time, take care of yourself and each other.